Hello, everybody. Welcome to today's webinar on building a quality monitoring system. My name is Michael Clausen, Quality Enhancement Specialist for CQL. Thank you all for joining us today. I'll just give you a little bit of background on myself. I've been working with the Council on Quality and Leadership since 2014. Prior to that, I worked with a provider organization and was responsible for managing a lot of the organization's data. I've also had an opportunity to work with a lot of organizations around the US and in Canada. And I know that building a quality monitoring system can be a little bit challenging and sometimes feel daunting. So we wanted to present today's webinar to answer some of your questions and hopefully demystify quality management. A little bit about CQL for those of you who are not familiar. CQL believes in a world of dignity, opportunity, and community for all people. Our mission is CQL is dedicated to the definition, measurement, and improvement of personal quality of life. And today we're going to be talking a lot about measurements. CQL assists communities, systems, and organizations to help people discover and define their own quality of life, measure personal quality of life for individuals, organizations, and systems, and improve the quality of life for people with disabilities, people with mental illness, and older adults, and the people, organizations, and communities that support them. So just a little bit of housekeeping. We will pause throughout the presentation today to answer some of your questions. I do have Kathy Yadamick kind of in the background, and she's going to help us to answer some of these questions as we move along. And the webinar is being recorded. So if you know someone who is not able to join us today that would like to check out the webinar, they will be able to find it within a few days by going to our website. There is a section on resources, and you can look at all of our archived webinars. Those are available. So just to get us started, I just wanted to kind of think about this word data. How does that word make you feel? Does it make you feel scared? Or are you like me and kind of a data geek? How does that word make you feel? The goal today, I really want to make data less scary and just kind of look at how we can use data and hopefully make it a little bit more approachable, no matter what your role is as it pertains to data. So today we're going to discuss the importance of data and analysis. We're going to talk about demographics and representative samples, data sources, building a quality monitoring system, presenting your data, analysis and action, and at the end, we're going to talk about factor 10 of the basic assurances. So for some of you, this might be familiar. If you work for an accredited organization or are utilizing the basic assurances, then you'll be familiar with factor 10. But if you're not, factor 10 is essentially how we monitor all of the other basic assurances. So more on that later on. So really, data is just information. So when we think of data, a lot of times we think of numbers and graphs, but really all that is information. And so some information can be expressed in the form of numbers. So if we think about data that we might have as an organization, we might think of patient errors, staff turnovers, we measure number of restrictions that we have in place, but other times this information may be more anecdotal and harder to measure. So that might include our success stories, people overcoming challenges, that kind of thing. Some things are harder to put a number on. So we really want to think about why we do this. Why should we bother with data? Why should we have a quality monitoring system in the first place? So what is the goal of that? So when we're thinking about numbers, this is just a representation here. In terms of building a quality monitoring system and what we can achieve with that, we can look at trends. We can do some cross analysis. So in this example, if we see a spike in medication errors in the fourth quarter, we might also look at the other data that we have during the fourth quarter, right? So what else is going on? Did we have an increase in our staff turnover or staff vacancy? By having a quality monitoring system, we can form theories as to what is causing our medication errors or whatever it might be. So we can look at what's going on in other areas of the organization as well, and we can try to figure out why those things are happening. And based on that, we can take some action to overcome those challenges. So once we identify a cause, we can kind of look at it and try to develop some solutions to try to fix it. We can also use data to strengthen areas of the organization. So if we're seeing a positive number, so in this case, it's personal outcome measures interviews, and if we're looking at our rights supports by residents in our organization, and we see that the Abbey Road residents has 100%, well, what are they doing at Abbey Road? So how can we replicate that in other areas across the organization? So these are all group homes named after Beatles songs. Okay, so how will data benefit your organization? So we can improve the quality of life for people that we support. So we could really stop there. I mean, that's really, at the end of the day, that's what it's all about, improving quality of life. So data will help us to improve quality of life for people we support. Data will allow us to monitor the health of important systems in our organization. So again, we can look at all of those different systems and see how well they are performing. Data will allow us to more effectively determine the cause of problems. So just as in our example, we could look at spikes in whatever it might be, medication errors or critical incidents, and we can try to determine the cause of those issues. Data will increase efficiency. So again, we can look at our data and finding out which areas are performing the most efficiently, and we can try to replicate that across other areas of the organization. And funding is increasingly outcome and data driven. So what we're seeing in a lot of states and provinces is that funding is increasingly tied to outcomes. So funders are increasingly looking at performance as a way to reimburse provider organizations. So going forward, it's going to be very important that we have these data systems. And your organization probably already has most of the data and expertise that you need in order to begin analysis. So if you think about your own organization, think about all of the data that you already have. I bet it's a lot. So just wanted to point out this resource that we've published at CQL. This is 12 Reasons Why Data is Important. So that is a resource that is available for free on our website. I have the URL here, but even if you just do a Google search, CQL 12 Reasons Why Data is Important, you'll be able to find that. And you can download it as a PDF. So demographics and representative samples. So demographics, this is another one of these scary words. I just wanted to kind of break it down a little bit. Before we begin collecting our data and trying to figure out how to analyze it, we want to consider how we will want to compare and analyze that data later on. So just as I showed earlier on our POM charts with the group homes that were named after Beatles songs, we saw that Abbey Road had 100% outcomes and supports met for people exercise rights. So those group homes, all of those individual group homes, that would be considered a demographic. So that's just one way that we can compare and analyze. That would be considered a demographic. We want to try to build these things in right from the beginning because it's a lot harder to do later on. Once we already have our data, our numbers, it's very important that we're building in all of those different demographic considerations right from the get-go. And just from the Merriam-Webster dictionary, a demographic is the statistical characteristic of human population. So other demographic considerations might be age or income. The US Census Bureau also collects information about the demographics of the US. So they do this every 10 years. The last one was in 2010. Some of the demographic information that they collect are about homes and families, the occupations of people, race, ethnicity, and they have a whole bunch of other demographic information that they collect about people who live in the US. Companies also collect demographic information, so everything from age to toothpaste preference. And corporations do this in order to market their products and target different groups who might be interested in buying their products. So again, this was from the Merriam-Webster dictionary. So what demographic information about your organization is the most important to collect? So there's some different things. You might not want to measure toothpaste preference. You probably do want to look at level of support need for people. That's one thing that you'll probably want to compare later on. So do people that receive a higher level of support need have higher outcomes than people who have a lower amount of support needs? So you might look at that in terms of the number of hours of service that you provide to certain people. You also might want to include other demographics such as diagnosis or where people live or what types of services people get during the day. So really you want to try to prioritize what's going to be most important to collect. So think about that ahead of time. Think about how you're going to want to compare that data later on. If you want to compare people by the place that they live, make sure you build that in. If you want to be able to compare by the level of support need, make sure you build that in right from the get-go. So where can you find this information? So again, this is probably something that you might already have. If you're using an electronic records management system such as Therap or Metasced or Precision Care, a lot of those systems already have that information built in. So you can probably pull a report. So again, this is one piece of information that you probably already have. Okay, so now we want to talk a little bit about representative samples. So this is another piece that is very important as you start to build a quality monitoring system and start to think about how you can use your data in a way that's more effective. You're probably going to want to do some representative sampling. So representative samples, essentially, this is looking at a small quantity of something to get an idea of what the entire population looks like. So the example here, in a classroom of 30 students of 15 males and 15 females, a representative sample might include 6 students, 3 males and 3 females. So in this example, they're using a representative sample of 20%. And it's representative of the population because 3 of those students are males and 3 of those students are female. So again, do your census. Once you have all of your demographic information, you can take a look at the population of people that you support, and you can build a representative sample. This will allow you to obtain valid data. So if it's not possible to survey the entire population of people that you support, or do a personal outcome measures interview with the entire population of people that you support, you can do a representative sample, and you should be able to get a pretty accurate result based on that. So this is going to be particularly useful in surveys, focus groups, and personal outcome measures interviews. So if you support 500 people and you only have 2 people that are able to do personal outcome measures interviews, it's probably not realistic to set a goal of interviewing all 500 of those people. That would be a lot. That would be pretty much probably one interview every single day for both people. So instead of interviewing 300, you should set a goal to try to get 10 to 20%. But again, make sure that the people that you do interviews with are representative of everybody. So again, we know that outcomes may be different for people depending on what types of support they're receiving, depending on their living situation, depending on a variety of other factors. But if you only do interviews with people that live in certain settings or people that get certain types of support needs, then your data is going to be skewed. So if you want to get an accurate picture in terms of outcomes or surveys or whatever else it is that you're trying to measure, it's very important that we use representative samples to make that data valid. So there is additional information on page 90 of the Personal Outcome Measures Manual. For those of you who are familiar with that, if you don't have a Personal Outcome Measures Manual, that is another resource that is available for free on our website. You can also order a hard copy of that, but that is also, if you look at our website and go under the Publications tab, you'll be able to find and download Personal Outcome Measure. Okay, so we'll just pause there. If we have any questions at this point.
So, Mike, the first question is, when you were talking about the representative sample and the personal outcome measures data, does all of that data have to be collected by a certified interviewer?
That's a good question. So, it's not something that is required. CQL doesn't require that only people that are certified and validated as certified by a CQL staff member can collect that data. But what is important is that you just know that that data is not considered reliable. Okay, so and so what that means is that it's not scientifically valid. That doesn't mean that you can't learn things from it. I think really organizationally and on an individual level, you can still use that information to learn. But just know that it's not considered reliable. So I know we get this question a lot with organizations that might have certified interviewers or certified trainers, but they also have a group of people that are able to conduct interviews. They've been through the workshop or they've had training on using the personal outcome measures, but they haven't been certified. So what I would say is you should still have those people use the personal outcome measures, still have all of those other people do personal outcome measures interviews. What I do suggest is that you have an internal process for assessing the reliability of that data. So I've seen different systems at different organizations, but you just want to have some process to take a look at that data, to challenge that data a little bit, and try to make it as accurate as you can. So also, within your data collection system itself, reliable and not reliable should be another one of your demographics, and that will sort and compare that information later on. And what that allows you to do is you can look at both sets of data, the reliable set of data, the not reliable set of data from your personal outcome measures. You can do comparisons. You can You can see, is there a big difference in certain areas or a big difference overall, and then you can take action to try to correct.
Thank you. There's another question, Mike. You've mentioned 20% a few times as the representative sample. Is that the scientifically valid minimum for a representative sample?
That's a good question. Scientifically valid minimum, that I'm not sure. 20% is the number that I like. You know, if you can't, I'm sure, you know, we could Google it and find out the correct answer. But you know, 20% I think is just kind of a good number to shoot for. You can try to get higher. You know, if you don't have the capacity or resources to get to 20%, I think if you're doing a valid sample of 10%, I think that's fine too.
Thank you, Mike. There are statistics calculators that you can go and Google and type in the number of people in your sample and determine how much, you know, what you want your standard standard deviation to be, those kinds of things. But this 20% is generally accepted within quality management and within CQL. So, but you're right, Mike, there is a website that you can go to and figure out what scientifically are statistically significant.
Yeah, and you know, 20%, that's kind of a good round number to shoot for. But again, it's we're not going to tell you that you have to do that. I think as long as your sample is representative, and I think you're going to be in good shape.
And then just one last question before you move on, Mike, and this had to do with the demographics that you were talking about earlier. And so how much demographic information should I be collecting as an agency? What are some good demographics to be looking at?
Yeah, that's a good question. So, you know, it's going to depend on your organization, what types of services you provide. But I think minimally, I think you want to be able to look at your data based on living situations. So, because we know that has a big impact on outcomes for people. I think it's also important to look at your outcomes and other data by the amount of support people receive. So again, that's one of these areas that we know that there's a variation in people's outcomes. So I think it'd be nice to look at. So, you know, looking at people who might get 4 hours of support per week versus people who get 24 hours of support every day, I think, you know, there's a big difference there. So I think you want to have those two. You could also look at, you know, by age. I think that makes a difference in outcome. Types of services that people get. So if somebody has day services versus another service, employment, I think, is a nice one to look at. So we know that people who are employed have different outcomes than people who are not employed. So again, really, it's going to depend a lot on your organization and what you're trying to achieve with your data. So if there's something that you know you want to look at, where maybe you've just kind of observed anecdotally, and you think that people who are getting this type of service seem to be doing better than people who get another type of service, then you'll definitely want to build that in right from the get-go. Okay, is that all the questions we have?
For right now, it is, Mike. Thank you.
Okay, great. So let's take a look at possible data sources that we want to include in our quality monitoring system. So again, I really encourage you to just start with the data that you already have. So I'm guessing you already have much of what you need to be able to move forward with a very good quality monitoring system. So that's really kind of what you want to start with first. Just take a look at what you're already collecting. If needed, later on, you could look at what other data might you collect to reach your goals. All right, so what we want to do now, we're just going to kind of go through and look at these by category and just kind of observe some of the data that we might be able to collect in each of these areas. I've categorized this loosely with the basic assurances, factor 10. We'll talk about that later on, but just to kind of keep us in neat categories, I've categorized this somewhat loosely with the basic assurances. So this might look familiar. So what data can we collect around rights to start with? So with rights, there is a lot of data that we can collect, a lot of information that can help us to understand how we're doing in this area. So we could look at rights assessments. We might be able to do specific surveys with people that we support, staff and family members. We can look at all of our Human Rights Committee data. So the number of restrictions currently in place, the number of restrictions denied or approved. We can look also going back to Human Rights Committee, we can look at the number of people that we support who are attending those committee meetings. We can also look at personal outcome measures data. So people exercise rights, people are treated fairly. So just to give you an idea of some of the data we can collect in the area of rights. Again, this is not an exhaustive list, but just to kind of give you an idea of some of the things that might help us to understand in this area. Okay, so if we're looking at respect, autonomy, and person-directed planning, there's a lot of data that we could collect around this. We can look at complaint data. We can look again at survey data from people supported, staff, families, so we can target some specific survey questions to take a look at this area. We can look at decision-making authorities, so we can look at number of people that have guardians, the number of people that have independent decision-making authority or some type of alternative form of decision-making support. We could look at our employment numbers. There's a lot of personal outcome measures data that we could look at in this area, and so sometimes when we look at our 21 personal outcome measures, sometimes that POM data might be a better fit in certain areas, or maybe it kind of covers more than one area. But just to give you an idea of some of the possibilities here, people are respected, people choose services, people decide when to share personal information, people choose where to work, where and with whom to live, people live in integrated environments, people participate in the life of the community, people choose personal goals, people realize personal goals. And again, some of those outcomes might be better fits in other areas depending on how you have your data collection categorized. Okay, so data around relationships. We can look at family contact notes or logs. Again, if you're using an electronic records management system, you might be able to pull certain types of data around this one. You can target some survey questions around this area as well. There's a lot of personal outcome measures that we can use to understand this area. So really all of the personal outcome measures that are around relationships, other than people decide when to share personal information. But natural support networks, people have friends, intimate relationships, interaction with other members of the community, and social roles. Okay, so some data sources around protection from abuse, neglect, mistreatment, and exploitation. So we can look at our incident management data. So there's going to be a lot of data that we could look at here. You know, everything from allegations to injuries of unknown origin, that kind of thing. There's a lot that we could look at here. And depending on the state that you live in or whether or not you're using an electronic records management system, you should have pretty easy access to this data. You should be able to pull reports pretty easily to understand some of this. So we can also do, we can also look at survey data from people supported, staff, family members. Again, there's human rights committee data that might be a good fit for protection from abuse, neglect, mistreatment, and exploitation. And we can look at some of our POM data as well. People are free from abuse and neglect. Okay, so some data around health, medical, and medications. Again, there's going to be a lot that we can look at here. Some of this might come from our incident management system. We can look at illnesses, hospitalizations, medication errors. It's possible that as an organization, maybe you have other types of biometric data. So just, data related to the health of people that you support overall. So that you might be able to include that. You can look at the percentage of people that administer their own medications. You can look at the percentage of people that are managing their own healthcare to some extent. So you might be able to build some surveys around this as well and look at your personal outcome measures data around people have the best possible health. Okay, so we're going to have a lot of data to look at in the area of safety. So you want to include data from internal and external safety reviews and audits. So any of the internal surveys that you're conducting as an organization, but also surveys that are conducted by external parties. So maybe it's the state surveyors or anybody else who comes in to audit you. That could be included as well. Again, there might be some incident management data that we could look at here, survey data. And of course, our personal outcome measures data. People are safe and people use their environments. All right, so looking at data around staffing and staff development. So for starters, we can look at staff turnover and vacancy data. We can look at data around staff development and training. We can look at survey data. We can also collect some data around how people that we support are involved in the recruitment, retention, hiring process. And of course, our personal outcome measures data. So in this case, people experience continuity and security. But we also might want to look at people choose services, because some of that kind of relates to our staff hiring process and how we support people to choose and select the staff that work with them. Okay, so looking at data around positive behavior supports. We can look at data regarding the usage of psychotropic medications. We can look at data regarding the use of physical interventions and behavior support plans. Again, we might be able to build some survey questions around this. Whoops. And I guess that's it. Okay, so again, that's not an exhaustive list of data that we want you to collect, but that's just to give you an idea. Some organizations do a lot more than this. Some organizations do less than this. So really, it just depends on your organization and what is most important to you from perspective of monitoring and being able to use your data to improve quality. All right, so I saw some questions pop up, Kathy.
Sure. So this is actually kind of a comment, and some human rights committees tend to approve almost everything that comes before them. So this person is suggesting that the human rights committee data also include how often they send a plan back as an unapproved, or for clarification, or for some more action before they approve it.
That's a good suggestion. I agree.
Okay, all right. And then, so there are some organizations who don't provide the 24-hour supports and services, but maybe provide us specific services or things. What are some ideas and strategies for collecting data? What do you collect that's different, and how do you collect it when you are not the 24/7 organization?
Yeah, that's a really good question. So, and we work with a lot of providers that might provide services only in a certain category. So maybe you only provide employment supports, or maybe you only provide case management supports or day services. And so your data system and what you're looking at in terms of monitoring quality, it's probably going to look different. And so again, at CQL, we don't really prescribe what you have to do in this area in terms of the different categories of data or the different types of data that you should be collecting, because we know that all organizations are going to be different. So, depending on what kinds of services you're providing, you may want to have a more um, enhanced focus on certain areas. So if you are an employment provider, you're probably going to have some additional data around employment. So for example, length of employment for people you support. I think number of people employed is just kind of a good one in general. Maybe for everybody, or maybe even as a demographic consideration, but you might want to track the wages of people that you support if people are willing to share that information with you. So it really all depends. If you are a case management provider, then I think you're going to want to do a lot more collection around person-directed planning and the extent to which people are driving that process. And so it really all depends. And if you have a specific question, again, I don't know where that question came from, but at the end of this presentation, I will put up my email. If you'd like to chat more, I would certainly welcome
that. Mike, this was just something that popped into my head as you were answering that question. And I think sometimes it's important to think about, even though it's an area that you don't focus on. So in employment agencies and agencies that are focused on employment, we see an impact that choosing where to work and doing what you want has an impact on other outcomes in terms of quality of life. And so sometimes it's good to go ahead and collect data on things that you are not directly responsible for, so that you can see that even though your services are focused on employment, that there are positive outcomes for people who are gainfully and happily employed on the status of their health and how they exercise rights as well.
Yeah, that's a good point. Yeah, we know that social roles and relationships in general has a big impact on employment, and which makes complete sense. A lot of times it's about who you know and what connections you have. So absolutely. So even if you are a niche provider or only providing services in a certain category, a lot of times having data around some of those other areas will enhance your understanding of the services that you're providing, even if it's just a specific category.
And that there are several questions coming in, Mike, and so I'm just going to remind people that we will, when this presentation is over, we send the recording and to our magic people in the office, and they convert it. They'll send out to all of the participants a link to the recorded webinar, and there'll also be a place to download the PDF of the slides. So it will be available for future reference. And then the other question that you could answer, if you would, Mike, is I'm curious about how agencies obtain data on recommendations that come out of the personal outcome measures. Specifically, how can we show that some people, how many people were employed or obtained employment after we learned that that was important to them through a POM interview?
That's a really good question. So some of your data, some of your information, you may be able to put numbers on that, as we discussed it at the beginning. But some of that is going to be more anecdotal, and so it's important that you're able to tell that story. And so maybe it's a narrative that you add to your data, or maybe there's somebody that's able to present that data. So, while the data might paint a picture, I think the picture is more complete if there's stories around that data to make it real. So, that sounds like something that maybe you could put a number on, but I'm not sure. And I would love to hear that story. That sounds really, really great.
And then there's one more question so far, and that is, Mike, what are your suggestions for how to standardize data across different systems of collection?
Standardizing data around different systems of collection. Well, so if we're talking about different systems of collection across an organization, maybe you have a quality management committee that gets together that decides, okay, all of our data is gonna look like this, and it's gonna be in nice, neat columns in Excel or whatever kind of system you're using. If you're talking about standardizing data across state systems or national systems, then the challenge, it may be a bit more challenging to be able to do that. But I think if I'm correct in what you're getting at is it is nice to be able to compare data across different systems, and so we're comparing apples to apples instead of apples to oranges. So just depending on what kind of system you're talking, I think that may look different depending.
So, Mike, there's a little clarification from the person who asked the question. She is referring to how do you keep data anonymous while also looking at how a person's POM relates to the number of incidents, etc. So I think it has more to do with that confidentiality.
Oh, okay. So keeping it anonymous. So yeah, one of the things that we do at CQL is when we do personal outcome measures interviews, and I know a lot of you out there are doing this as well, but you're entering that information into the portal database, or even if you're using a different system to manage that personal outcome measure data, or maybe it's a homegrown system or a different electronic record management system, people's names are attached to the data, but when you generate reports, those names are not attached, right? So, we look at the data, we might look at the number of outcomes that supports met in a certain area, but we don't necessarily know the people's names that did have the outcomes met or did not have the outcomes met. So usually, it might just be a graph, or it might be like a bar chart or something like that, or a percentage, but usually people's names are not attached to that data. All right, so now we want to take a look at how to build a data collection system. And again, this is just a webinar here, so this is just kind of the very high level overview of how to build, but we did want to give you some examples and just some reference here in terms of data collection systems. So again, start analyzing what you already have and just allow your system to evolve. So, get started now. I know that the organization that I worked for, we had something that was that we thought was great at the beginning, but then it just continued to evolve over the years. Over time, you might find data that might be useful to you, so you might want to include that, or maybe you have data that you haven't looked at in a long time, and so you can just get rid of it. So these systems tend to be evolving continuously. So you also want to delegate responsibility for collecting data based on who is responsible for each area. So, it's hard for one person to do this all themselves, particularly in large organizations. So delegate it. So have your HR person report on staff vacancy, and have your behavior specialists report on the number of behavior support plans. So depending on who is responsible for providing that type of service or monitoring that specific area, delegate them to collect the data in that area. Keep all of your data organized. So put it all on a shared drive or a cloud drive if you're using the cloud for your data. Keep it all in one place and keep it organized. So one thing to note, graphs are great, but you can be just as effective with a system that is easier to build. So I like graphs. I think that they are very pretty, but you know, it can be a challenge for some people. And you can be just as effective with something that is easier to build. So you don't need to be a statistician or somebody who's really good at using databases or Excel and still be just as effective. So when you're doing your data, set deadlines and timeframes. So how often are you going to look at that data? How often are you going to act on it? Is it going to be monthly? Is it going to be quarterly? You also want to keep all of your team members accountable to those timeframes. So if you're responsible for getting all of your data in by the 10th day following the end of the quarter, everybody needs to stay accountable to that. Okay, there's a lot of opportunity for automation and efficiency with your data. So, you know, really what I suggest, and the way that I learned how to do a lot with data is just by watching YouTube videos and looking for resources online. I am not a statistician by training, but I do realize the need to be able to do things with data, and do know that it can make people's lives better. So you know, there's a lot of resources out there, but try to make your data system as efficient as possible. All right, so wherever you can automate, wherever you can make things more efficient. All right, so some tools that you can use, the CQL portal database. So if you're using that for your personal outcome measures interviews, there are quite a few analysis features built in. And so our data guru, Carly Friedman, has produced a number of YouTube videos. So you can access those either through our website or on YouTube. You could just do a search, CQL portal database, and you should be able to find those pretty easily. I tend to like Excel and pivot tables, so check those out. Again, there's a lot of resources on the internet on how to create pivot tables and how to create charts in Excel. There's a lot of free online graph makers as well, where you can just plug in your information manually, and that will produce a graph for you. So surveys and online survey platforms. So if you're obtaining some of your data through surveys, there's a lot of resources out there for that as well. SurveyMonkey for one, but there's a bunch of them out there. The thing that I will say about surveys is if you're going to do surveys, try to build questions that are open-ended. Okay, so if you're getting a survey and it says that 99% of people are satisfied with what you're doing, I'm not really sure how valuable that is. All right, so even if 99% of people are truly happy with what you're doing, you really need to ask why. What are we doing well? Okay, so you know, think about what you're doing with your surveys, and is it of value? If you're not getting anything of value with your surveys, then either reconsider how you're conducting your surveys or just stop doing them and do something else. Okay, so your electronic records management systems. So for those of you who are using them, there's a lot of capacity there to be able to pull reports and get a lot of really good information from those. Okay, so just to give you some ideas here, these are some data collection systems. So here is an example for one. This one comes courtesy of Ability Building Services in South Dakota. Thank you guys for letting us share this one. And you can see that this was done on a Microsoft Word document, and it's just kind of a chart, and it's got the different headings built in, and you can kind of see some of the different data that they're collecting. And so again, this is not a graph, but it is, just as effective as having graphs. All right, so they're able to look at their data just using this Microsoft Word document. All right, and this next one here is one that I put together. This is just more graph-based. So, just looking at factor 3 natural supports, but this is one way to do it as well. So we can see all of our data from all of the different quarters and be able to do some comparison. And this one is courtesy of AHRC New York City. So this is a very large organization, and they have quite a bit of resources and capacity to do some really cool things with data. And this system is one that is certainly more complex. So, but you can be just as effective with something like this. So really depending on your organization and your ability to be able to perform analysis and your understanding of it, this might work for you, or something like this might work. And again, this is not something that CQL tells you you have to do a certain way. As long as you are learning from your data and using it to make your services better and using it to make the lives of people that you support better, then we're happy. That's really all we want you to do, is learn from your data. All right, Kathy, questions?
So after the discussion, Mike, someone suggested that to preserve and make sure everything is kept private, that you use initials or some kind of unique identifier number, or combination of numbers and letters. And then that way you could still track the data, but it would be by some unidentified information.
A good suggestion.
So, and this may partially be answered by some of the things that you showed. Is there a requirement that data is reviewed on a certain schedule, like monthly or quarterly, or 3 times a year, or what? Or how do I determine what's the best method for reviewing the data, the timelines?
Yep, good question. So this is not something that we prescribe to you at CQL. Really, it's going to be dependent upon your organization and the area. I think a formal review of your data, I think for most organizations, probably quarterly, but you may want to have certain groups that are continuously responsible for monitoring various aspects of your data. So an example of that would be, you probably want the person who's in charge of nursing or health at your organization to be able to monitor illnesses on an ongoing basis. You're probably not going to wait until the end of the quarter to monitor how you're doing in that area. So it really just depends. I think quarterly is probably a good round kind of way to look at it, and then maybe you can do an annual report as well. But again, it depends on what you're looking at, and it depends on your organization. But we don't prescribe it at we don't tell you how often you should.
Okay, so along those same lines, Mike, so once the data is collected and compiled, and you've already suggested that, people who are directly responsible, like in HR, would be reporting data on HR, is there a suggestion on who should be reviewing the data?
Yep, that's another good question. So you want to, and this is probably a good segue here because we're getting into analysis and action, but yeah, so really a formal review of your quality monitoring system when you're looking at all of this data from all of the different cross sections, it's good to have all of those systems, all of those programs represented, and so really the idea here is just as our example about the medication errors and staff turnover. So it's important that the nurses are able to look at staff turnover data. It's important for the behavior specialists to be able to look at the amount of illness that's happening throughout the organization. And so that's kind of the idea. It's important that you have a broad representation, and so you can look across those different systems and really try to get some ideas about why things are happening, and be able to look at data that doesn't necessarily, even if it's something that you're not directly responsible for, might help you to make things better in the area that you oversee.
So Mike, I might have misunderstood the question. There was some clarification, and it's really about who gets that report out of the data, who gets to, after it's been looked at, who does that information go to?
Typically what we see, the way that this is set up, is organizations will have some kind of quality monitoring mechanism. And so that mechanism is usually a committee, or if you're a smaller organization, maybe it's just a couple of people that get together to look at it formally. And so, what that also allows is the people that are responsible for different sets of data, they can present it, they can answer questions about it. But again, I think you want that broad representation from all of the different programs and areas at your organization, so that you can all look at it together. So typically that's what we see is some kind of system. Sometimes it's a committee or group of people that get together on a regular basis to look at it and go over it and decide how you're going to respond to it. So I would think within that process, you probably want to have some kind of data report or dashboard. So, something like what we showed earlier, you're probably going to have something like this that has all of your data, but you're also probably going to have an ongoing way to report all of the different actions that happen as a result of looking at that data. So, you're probably going to keep committee meeting minutes that kind of spells out the action steps, or maybe that's just included as part of that report on an ongoing basis. Maybe you have a section that shows actions completed or actions outstanding.
So in your experience, Mike, how has the executive director of an organization or the members of the board of director been involved in this data information sharing?
Yeah, I think that they should be involved. If the executive director is not part of that committee, they should certainly get a copy of the report. I think the board of directors should also get a copy of that report. I think it's good that they be involved. I know a lot of organizations have liaisons from their board of directors on the quality monitoring committee, just as the liaison, and so that person is responsible for presenting the report to the board of directors at the board of director meetings. So that's one thing that we've seen. Some organizations, the executive director sits on that quality monitoring committee. So really, just depending on your organization, they should be involved.
Thank you. I think that is the end of the questions for right this minute.
Okay, great. So good segues here. Moving on to analysis and action. So again, you're going to want to assign responsibility for analyzing the data that you collect. So that's one thing you want to think about. Who is going to be responsible for analysis? So again, talking about that mechanism, right? What is the mechanism going to look like? Is it going to be a committee of people that meet? Is it going to be just a couple of people? But you definitely want to consider how you're going to do that. And so who is responsible for analysis? Who is responsible for carrying out all of those action steps? right? So you'll want to think about that. You'll want to build that accountability into your quality monitoring plan. So again, we'll get into factor 10 of the basic assurances in just a few minutes here, but you want to have that as part of your quality monitoring plan or your quality monitoring policy. And that way the accountability is built right in. Okay, so set some achievable goals. So you can set goals around your personal outcome measures or around some of your health areas. But that's another great thing that you can do with your data. You can establish those baselines. Where are we at right now? And you can look at that and you can set some goals to try to achieve them. Okay, so again, you're going to want to have a plan for how that data will be collected and organized. So going back earlier, I showed you the categories that I had my data organized around. You're going to want to do that as well. So think about what data you're going to be collecting, where does it fit? And again, who is responsible? So kind of speaking again about that delegation, make sure that that's included. Who's responsible for analysis and the action steps. So at that point, you're going to want to set your timeframes too. So are you going to look at this monthly? Are you going to look at it quarterly? But set those timeframes and stick. And then again, keep everyone accountable. All right, so some additional resources here. So YouTube, there's a lot of resources on there. I'm a big fan of YouTube. But you can look, there's resources on the web as well. I really encourage you all to share what you're doing. So partner with organizations in your area that are doing this well. Partner with other organizations that are using the personal outcome measures or that are accredited. So don't try to reinvent the wheel. If somebody has a good system and it's working, see if they would be willing to share and see what you can share with them. So I think that sharing is really great. There's a lot of organizations that are very successful that do a lot of sharing, and it's something that I definitely encourage. And also check out the CQLE community on Facebook. There is a lot of great discussion happening there. So if there's something that you need, or you're looking for a resource, or you're looking for a partner organization to share some ideas, use the CQLE community on Facebook to reach out to your colleagues. Okay, so we'll pause there for questions.
So Mike, there is a question, and it is, does CQL offer assistance with helping agencies determine what data sets by program and department that the agencies or that CQL feels may be necessary when the agency needs help?
Yeah, you know, I mean, we one of the jokes at CQL is that we're not lawyers, so we don't charge by the minute. So I know that I always welcome emails and phone calls, and you know, if you have a contact at CQL, you could reach out to them. If you haven't worked with somebody at CQL, again, my email is going to be put up there at the end of this presentation. So, you know, informally, we're happy to help you in that way. We do provide some training around the basic assurances and Factor 10, and we can do, we also customize some consultation as well. So if you are at an organization that wants to purchase some consulting services, then feel free to reach out about that as well. But if you just want to chat or have some questions, you know, one of us would certainly be happy to help. Any other questions at this point?
So just the person that asked that question said she'll be in touch. Then there's another one, and Mike, you might be getting at this, and so if you are, we can just wait till you get there. Can you share some examples of how agencies give their data to stakeholders other than stakeholder events and family meetings and those kinds of things? Do you Do you have some ideas? Have you seen some good practice around that?
That is a good question. I'm gonna hold on to that question for just a few minutes here because I want to jump into factor 10, and I do have a section about sharing that information, so sharing and involving others. So we'll get to that one in just a few minutes. If I don't answer your question, please ask it again. but I think I will. All right, we good?
Sorry, we're good, Mike.
All right, great. So jumping into factor 10 of the basic assurances. So I know that factor 10 of the basic assurances can be a challenge. And I remember way back when I was working at a provider organization and trying to wrap my head around some of this stuff, I know that it was quite difficult. And I have worked with a number of organizations who have found this one challenging. So we wanted to spend a little bit of time on this and try to answer as many of your questions as we can. So I just, for starters, really what this is all about is quality monitoring. So factor 10 is really all about how you monitor quality at your organization. So, basic assurances are all about quality, and factor 10 is how you monitor those different basic assurances. And so that's really what this is all about. And this is really what you want to try to achieve within factor 10 is how will you monitor quality? How will you monitor those basic assurances? So that is what factor 10 is all about. There's no substitute for having direct knowledge of the issues impacting people's lives. So all of that health, safety, personal security information, it's important that we monitor that on an ongoing basis. What factor 10 asks organizations to do is come up with a formal plan that outlines how it will monitor and evaluate the presence of basic assurances. So again, that's why we have all of these monitoring systems, all of these systems that contain data, is because that's how we monitor and evaluate the presence of those basic assurances. So really this is going to occur on two levels. We want to look at it on both the micro level, so the individual, and the macro level at the larger organization. So we kind of look at it on both levels. So 10A of the basic assurances, that indicator 10A, this is directing organizations to establish a policy that describes how you're going to do that. So that really is the foundation. And then 10B of the basic assurances is your actual quality monitoring plan. Okay, so just wanted to spend a little bit of time here dissecting a few of these probes and talking about them a little bit. So 10A of the basic assurances, again, this really is largely about policies. So our first probe here is, does the organization have policies and procedures that describe its plan? So that's really the first step. We want organizations to keep themselves accountable and put together a policy for how they are going to do this. So again, kind of looking back to, we talked about the delegation and keeping everybody accountable. Your policy should really identify who is responsible for overseeing the plan. So again, keep yourselves accountable, identify who is responsible for doing that. And also, so you have your people who are responsible for overseeing the design, and you have your people that are responsible for implementation of the plan. So who is responsible for creating the plan and putting it together, and then who is responsible for implementing it. And then, your policy should really describe your commitment to attain and maintain the presence of basic assurances outcomes over time. So a lot of times that is really just a policy statement that demonstrates your commitment to maintaining the basic assurances over time. So I tend to think a little bit more linearly, and I like these grids, I like charts. So so this is one way that you can do it. You can have a chart that kind of shows your different basic assurance indicators here, and then you can describe what data will be collected. So again, kind of going back To earlier, we talked about factor one and rights, and so you could say, well, human rights committee data such as restrictions not approved or per the person's suggestion, restrictions that were kicked back for further review, personal outcome measures data. So, whatever data it was that you decided that you were going to use, you can kind of lay it out in that chart. And then you're going to delegate who and how often will the data be looked at, who is responsible for carrying out action steps. So I like charts. You could do this as a narrative as well, but I like charts, but you don't have to do it that way. Okay, so 10A, so getting to the person's question about sharing and involving stakeholders. So we do get a lot of questions about this. So we have this probe here, number 7. Does the process include methods to inform and educate people, their families, and support staff about basic assurances, and to solicit their involvement in the evaluation process? Okay, so there's a lot going on here. So for starters, what I tend to say is that you should really always put what you're sharing into context. So, sharing your entire monitoring plan, putting that out there on Facebook, I probably wouldn't suggest doing it that way. I mean, you could if you want to, but really it's important to give people the proper context, right? So I think one of the things that a quality monitoring system lends itself to well is celebrating successes. And so that's probably where you should start. Do 75% of the people that you support have a social role that is meaningful to them? Well, maybe that's something that you could share and talk about what that means for people. Okay, so you can share snippets of the data that you're collecting. You can touch on this in your organizational newsletters. You can do it through social media posts. You can do it at your annual meeting. But there's a variety of ways. But what I tend to like the most are the snippets that celebrate your success. Okay, and in terms of soliciting people's involvement in the evaluation process, this tends to be a little bit more challenging. But for starters, you should have some representation from other stakeholders on your quality monitoring committee. If that's the route that you're going to go, make sure that you involve people that you support, family members, other stakeholders. They can be involved in that collection process. Maybe they could facilitate focus groups for you. Maybe you could train them to conduct personal outcome measures interviews. But just as with everything else, it's important that we have everybody's perspective. So, remember, this is not just about token involvement and having people on our committees. We really want to hear their perspective, and that's really what it's all about. And we find that perspective is very valuable. So that those voices are usually, looking at things from a different perspective than we are as service providers, and it's really valuable to have that perspective. I hope I answered your question. Okay, so again, this one is about stakeholder involvement and sharing as well. So again, we can involve family, people we support, and other stakeholders within the collection, within the evaluation. And sharing, so this is similar to the probe in number 7. How are we sharing the results of the plan? So again, give it context, use it as an opportunity to celebrate your success. Okay, and then again, is the plan modified with input of people? So I think all 4 of these probes, you can achieve all of them with a good process for sharing, a good process to get people involved. And so think about that one. Think about what it's going to look like, and make sure you put it in your policy. Okay, hold yourselves accountable to that. Okay, so 10B. So 10B, this is the actual plan. So data and analysis. So remember, 10A is our policy, 10B is our plan. And so we have a few probes here that we'll kind of look at together. Are the measures identified that indicate the presence or absence of important elements? Are the data sources and methods of collection identified for each measure? And are the methods of data analysis and evaluation identified for each of the elements? Okay, and we have, just get all of them up here on the screen. Do the methods used to enable the analysis of both a single critical event or incident and system outcomes? Okay, so let's talk about 3 through 5 first. So really that, what we talked about earlier on about all of the different data that we collect as an organization, those are the things that are going to give you that multi-dimensional approach to looking at each of the basic assurances. So, we can't navigate only by looking at one star in the sky, right? So, with our data systems, we're going to want to look at different sources of data and different aspects of what we're doing in order to get a good picture of how we're performing. So that's really what this is saying. Are we identifying the different data that we're collecting to be able to monitor those basic assurances? Okay. So number 7, does this allow us to look at both a single critical event or system outcomes, right? So again, looking at both the micro and the macro, does this allow us to look at things in isolation, so a single critical event, as well as the trends overall? So can we look at one incident, and then can we look at the trend of incidents over the course of a period of time, a quarter or a year? All right, so 8 and 10, similar to 3, 4, 5. So again, we're going to want to look at data from a variety of different sources and systems. We're going to want to be able to perform that cross analysis and look at all of those different pieces of information to be able to learn. Okay, so all right, so that's the probes of basic assurances, factor 10, A and B. So those are some of the more challenging ones that we tend to get the most questions about. But we do, we're happy to answer any other questions that you have at this point, whether it's about what we presented here so far, or if you have any other questions about factor 10 or basic assurances in general, we would be happy to answer those at this point.
So, Mike, it appears that there are not any questions right now. I think we're a little over in terms of time, so I suspect some people have fallen off because they had other things they needed to do. If anybody comes up with any questions, though, you'd like them to contact you, is that right?
Yeah, I'd be happy to chat for sure. So I'm surprised that there's no questions about factor 10, but well, maybe we've answered them all.
Or they're going to contact you and you're going to have a barrage of emails. So,
right.
Mike's very good about responding, so please feel free to do that.
Absolutely. Well, I want to thank you all for taking the time to tune in today. So as promised earlier, my email address is up here on the screen. So if you have any questions about what we presented today or anything else that you want to chat about, I would be more than happy to do that. Shoot me an email and we will chat. So thank you, everybody. So again, the webinar here will be posted up on our website within a few days. Kathy, did a question just pop up? I just saw the little dialogue box.
No, just a thank you. Thanks
Okay.
so much. So lots of just thank yous.
Okay, perfect. Well, thank you all. It's been a pleasure, and look forward to hearing you. And thank you, Kathy, for helping us with the questions.
All right. Well, thank you, Michael.
Okay.
Bye, everybody. Have a great afternoon.